Good morning, chairpersons. Thank you for giving me this opportunity to present my paper. My topic is comparative analysis between bilateral implantation of standard diffractive trifocal intraocular lens and new continuous range of vision intraocular lens in Indian population. The purpose is to evaluate the clinical outcome and patient satisfaction after implantation of diffractive trifocal intraocular lens PanOptix TFN2 and new continuous range of vision intraocular lens Technis ZFRU5. The prospective non-randomized comparative study, single surgeon, tertiary care eye hospital, data analyzed with SPSS software version 20. Group 1, 20 patients, 40 eyes, bilateral diffractive trifocal IOL, PanOptix TFN2. And group 2 has 20 patients, 40 eyes, bilateral continuous range of vision, IOL Technis ZFRU 5. Outcome measures were taken at 90 days. Uncorrected distance visual acuity, photopic and mesopic best corrected distance visual acuity, uncorrected intermediate visual acuity 80 centimeter, 60 centimeter, distance corrected near visual acuity 40 centimeter, photopic and mesopic distance corrected near visual acuity at 33 centimeter. Contrast sensitivity, binocular defocus curve, day and night driving and nighttime activities, dysphotopsia profile. These were the inclusion and exclusion criteria. The analysis of preoperative patient data of two groups for number of eyes, age, gender, axial length, pre-op myopic sphere, pre-op hyperopic sphere, and pre-op cylinder were comparable. And group statistics and t-tests for equality of means were done in all the for all the outcome measures. And we found that the binocular uncorrected distance visual acuity between bilateral trifocal group 1 and bilateral CROV group 2 shows better photopic uncorrected distance visual acuity in group 1 as compared to group 2, but it is comparable. The best corrected photopic distance visual acuity 3 months post-op showed better photopic best corrected visual acuity in trifocal group 1, but difference was comparable. The best group statistics and t-tests for equality of means for mesopic binocular best corrected distance visual acuity showed better mesopic best corrected distance visual acuity in group 2, but it was non-significant. Again, the statistical analysis for binocular uncorrected intermediate visual acuity at 80 centimeter shows better result for group 2, the CROV lens, but it was non-significant. And for 60 centimeter also, the results were comparable between the two groups. For 40 centimeter binocular distance corrected near visual acuity, the results were comparable. The photopic near visual acuity at 33 centimeter between group 1 and group 2 showed group 2 is better and difference is significant. P is 0.00. And for mesopic near visual acuity distance corrected at 33 centimeter, again group 2 is significantly better, P 0.00. The contrast sensitivity photopic with glare was comparable between the two groups at 5, 10 and 15 CPD, but contrast sensitivity mesopic without glare was significantly better in group 2 at 5 and 10 CPD. Group 2 means continuous range of vision. And again with glare, without glare, it was significantly better in bilateral CROV IOL group 2. The statistical analysis for binocular defocus CROV ZFRU 5 showed significantly better result at versions of 3 diopter. This is the graph for the same, showing the significantly better vision and 3D focus. The QVIT questionnaires were applied. The proportions experiencing binocular glare often and very often was lower in continuous range of vision versus group 1. The difference was significant. 13 out of 20, 65% patients in group 1 versus 2 out of 20, 10% patients in group 2 experience halos for often and very often. The difference of 55% for combined often and very often is significant, is P 0.0004. Occasional experience of halo was significantly less in group 2, means halo occurrence was significantly less in group 2. So CROV IOL Technis ZFRU5 has significantly more satisfaction with nighttime activities than group 1. Patients able to read menu in the dimly lit restaurant, patient able to see objects and read street lights in the evening or at night, patients able to see steps or curves in the evening or at night. It was better in the group 2, significantly better. Nighttime driving was also statistically significantly better in group 2 CROV lens because it has a UV filter also. And 19 out of 20 patients in group 2 versus 16 out of 20 patients in group 1 opted to choose again this intraocular lens. But again, this difference of proportion 15% is not significant. So what this study adds, bilateral implantation of CRV IOL results in continuous range of vision without any gap, with a flatter defocus curve at intermediate zone and significantly better near vision at 33 centimeter and significantly better contrast sensitivity at mesopic conditions, significantly less photic phenomenon. So conclusion is gaps in visual range problem, nighttime activities problem, and dysphotopsia problem. All these in trifocals may be solved by CRV IOL. I have no financial interest. These are the references. Thank you.